So this study is a case control study that we've done in combination with Cure Parkinson's Trust, and it came about due to the links between Parkinson's disease and type 2 diabetes. So type 2 diabetes is a risk factor for Parkinson's disease and the severity of Parkinson's disease, and inflammation and control of glycaemic control can be potential drivers of this relationship. So we designed this cross-sectional biomarker study to try and look at whether type 2 diabetes is associated with a more severe phenotype of Parkinson's disease. And we did this using blood-based markers of neuroaxonal damage, of inflammation, and of glycemic control. As well as this, we also looked to see whether type 2 diabetes was a driver of a more severe phenotype in Parkinson's disease using these biomarkers by correlating the biomarker levels with the clinical data that we received. So in terms of our methods, we recruited patients in three main groups. So we recruited healthy controls, we recruited patients with Parkinson's disease without type 2 diabetes, and we recruited patients with Parkinson's disease and type 2 diabetes. And we were aiming for sort of 60 patients within each group. Patients came in to visit us, and we took blood samples for both. We took venous blood for plasma, and we collected both finger prick dried blood spot cards, and we made venous dried blood spot cards from the venous blood that we were given from the participants. And the participants also underwent a full clinical assessment. And of that, what was used in these analyses, we used the Movement Disorder Society UPDRS Part 3 score as a motor score for participants. And we used the Montreal Cognitive Assessment, the MoCA, for a score of the cognitive symptom severity. So using the blood samples, we analyzed these blood samples for plasma levels of neurofilament light chain, so neuroaxonal damage, for pro-inflammatory cytokines, so we measured interferon gamma, IL-6, IL-1 beta, and tumor necrosis factor alpha, TNF-α, as well as CRP, and the dried blood spot samples were used to measure HbA1c as a measure of glycemic control. So in terms of the results, in all Parkinson's disease patients, there was very strong evidence comparing Parkinson's patients to healthy controls for elevated levels of plasma neurofilament light chain and lowered levels of plasma interferon gamma. There was also a trend towards elevated levels of plasma IL-6 and TNF-α, which shows that there were higher levels of inflammation in the Parkinson's group in total compared to the healthy controls. And then when looking at just the Parkinson's disease patients with type 2 diabetes, there were trends towards elevated levels of inflammatory cytokines IL-6 and TNF-α compared to the PD patients who did not have type 2 diabetes. Again, showing that perhaps there is actually an increased level of inflammation in Parkinson's patients with diabetes compared to those without. And then doing a comparison between the Parkinson's group with type 2 diabetes and the Parkinson's group, both compared back to the healthy controls, a more significant increase was observed between the healthy controls and the PD type 2 diabetes group of the plasma levels of neurofilament light chain and inflammatory cytokines, IL-1 beta, IL-6, and TNF-α. So that essentially is compared to the difference between Parkinson's patients and controls was smaller. So by looking that way, we actually managed to see that there were also increased levels of neuroaxonal damage in Parkinson's patients with type 2 diabetes compared to those without. So then going on and looking at the clinical data, from regression analyses in Parkinson's patients with type 2 diabetes, after adjusting the analyses for age and the time since diagnosis, a very strong correlation was observed between levels of plasma neurofilament light chain and the cognitive assessment by MoCA and the motor assessment by MDS UPDRS Part 3. However, this relationship was either weakened or not observed at all when you look at just Parkinson's patients without type 2 diabetes, or you look at control patients. So the relationship between plasma neurofilament light chain and cognitive symptom severity was much stronger when you only look at patients with Parkinson's disease and type 2 diabetes. Finally, we did look for differences. We looked for correlations between glycemic control, so HbA1c, and motor and cognitive severity, but did not find any correlations in any of the groups, nor did we find any correlations between glycemic control and plasma neurofilament light chain, so neuroaxonal damage, in any of the groups. So to kind of wrap this up, to conclude this, these data show in case control comparisons that there were higher levels of inflammation and neuroaxonal damage in Parkinson's patients with type 2 diabetes compared to Parkinson's patients without type 2 diabetes, which adds further evidence to the potential role of inflammation in this link between Parkinson's disease and type 2 diabetes. And finally, also regression analyses highlighted that there's a strengthened link between plasma neurofilament light chains. So the use of plasma neurofilament light chain as a progression marker, it showed faster progression in patients with Parkinson's disease and type 2 diabetes compared to just Parkinson's disease patients without type 2 diabetes. And we're hoping that future studies will focus on looking at these same markers, but maybe in a longitudinal way, so we can assess markers of inflammation, neuroaxonal damage, and glycemic control in patients with Parkinson's disease and type 2 diabetes over time. Thank you very much.